Hello and welcome to the Machinist News Network. I'm Deirdre Kanievsky. Many people believe that Washington is finally recognizing the need for national health care. And just recently, big steps were taken on Capitol Hill to make sure this happened.
What do we want? Health care! When do we want it? Now!
For the men and women of organized labor, a national health care plan means the bargaining table becomes less of a battlefield just to break even. But it's taken nearly a century for national health care to start to come to fruition.
The first person who proposed national health care was Theodore Roosevelt. That was 100 years ago. We're not going to wait another 100 years. We're not going to wait another 50 years. We're not even going to wait another year. We're going to do it now.
That's why it's big news that Congress is making serious progress on a health care bill that would cover most Americans. Health care is one of many issues always near the top of labor's priority list.
We would not have Medicare without you, so thank you. We would not have Social Security without you, so thank you. We would not have child labor laws, so thank you. And every one of those things didn't start out in the mind of some legislator in Washington. They started out in union halls and church basements all around this country. You're going to make it happen again, and I'm going to be there to help.
Right now, numerous proposals are moving through the halls of Capitol Hill. Just last week, the House and the Senate unveiled bills that would expand coverage to the majority of uninsured Americans and revamp programs like Medicare and Medicaid. Both plans rely on taxes levied on some larger employers who do not offer health insurance to their workers. The House wants additional money to come from taxes on America's wealthiest population, or about 1.2% of all households, while the Senate hopes the insurance industry will make a $100 billion contribution over the next decade to pay for their plan. Whether these bills pass or not, support for a national plan seems to be coming from every walk of life and supporting labor's message.
It's bad enough the emotional impact of not having a job, but to get sick on top of that and worry every day that your symptoms are not getting better, figuring out what you're going to have to do without so you can afford a doctor's visit. I am far more familiar with that than I am with my situation these last number of years.
Today, health care plan proposals can be found in both the Senate and the House, and on both sides of the aisle. President Barack Obama says he wants to see a plan that slows the cost of health care and keeps insurance companies honest. For more, you can log on to goim.org. Thanks for watching, and we'll see you next time on the Machinist News Network.